When should you get tested for genetic hyperlipidemia? Have you ever wondered if your cholesterol levels could be linked to your genes? Understanding when to get tested for genetic hyperlipidemia can be a game changer for your health. Genetic hyperlipidemia, especially familial hypercholesterolemia, is a condition that can significantly impact your heart health. Knowing when to seek testing is key to managing this condition effectively. Testing is recommended when there is a strong suspicion based on cholesterol levels and family history. For children, if they have persistently high low-density lipoprotein cholesterol levels of 160 milligrams per deciliter or higher, it is time to consider testing. This is especially true if a parent has low-density lipoprotein cholesterol above 190 milligrams per deciliter, or if there is a family history of high cholesterol or early coronary artery disease. For adults, testing should be on the radar if low-density lipoprotein cholesterol levels reach 190 milligrams per deciliter or higher without any obvious secondary causes. This is particularly important if there is a first-degree relative with similar cholesterol levels or a history of early coronary artery disease. If you have very high low-density lipoprotein cholesterol levels of 150 milligrams per deciliter or more, even without a family history, it is advisable to get tested. Additionally, if you have a personal history of early coronary artery disease, along with a family history of hypercholesterolemia and early coronary artery disease, testing is warranted, especially if you do not have pre-treatment low-density lipoprotein cholesterol levels available. Universal cholesterol screening is also recommended for children aged 9 to 11 years. This helps identify elevated low-density lipoprotein cholesterol levels that may require further evaluation for familial hypercholesterolemia. Genetic testing can identify mutations in important genes that cause familial hypercholesterolemia. Confirming a genetic diagnosis can guide treatment decisions and allow for screening of family members who may also be at risk. A positive genetic test increases certainty about the diagnosis and indicates a higher risk of cardiovascular disease compared to individuals with similar low-density lipoprotein cholesterol levels but no genetic mutation. Even if genetic testing does not reveal a mutation, a clinical diagnosis can still be made based on cholesterol levels and family history. So, if you or your child have persistently high low-density lipoprotein cholesterol levels, especially with a family history of high cholesterol or early heart disease, it is wise to consider getting tested. Early identification through testing allows for timely management to reduce the risk of cardiovascular complications and helps screen relatives who may also be affected.